While every segment of the population has dry eye sufferers, those most susceptible to dry eye are people above age 50, especially women, contact lens wearers, people with systemic diseases, and people who have had corneal surgery. For some, dry eye is a mild irritation, but for others, can even lead to vision impairment. We spoke to the doctors of NVISION Eye Centers about managing dry eye disease and learned how one company, Oasis Medical, is helping patients cope with this possibly serious condition.
Dry eye affects probably every aspect of my life because it affects what we look forward to in every day. If we're feeling good, if our eyes are feeling good, then we're more apt to want to go out and do things. It tends to create depression for a lot of people because you wonder how are you going to manage your life with this condition because it's very painful.
Many things can cause dry eye. It's multifactorial. It could be age. As a patient ages or a person gets older, your risk of dry eyes increases. It could be gender. Women tend to get dry eyes more than men, so older women have a higher risk of dry eyes than almost any other population. It could be other medical problems such as rheumatoid arthritis, lupus, diabetes. It could be environmental. For example, if you're exposed to cigarette smoking, if you live in an environment that's extremely dry, or it could be something if you take medications or certain products into your body that can cause dry eyes.
I have suffered from dry eye at least 10 years, but I had initial symptoms probably 20 years ago, now that I look back.
Dry eye can be a very difficult condition to live with. At its worst, I get headaches, I have a hard time keeping my eyes open, I blink a lot, I have a lot of pain. It feels like a foreign body is in my eye.
I suffer from dry eye mostly, almost every day, but it's varying degrees. Some days it bothers me very little, and then some days it bothers me worse. I have to say it's better now than it was 17 years ago when I first started because I've learned ways to manage it.
So if dry eyes are left untreated, patients become more and more symptomatic as time goes on. It does affect the vision, but it also affects the productivity of the patient in that there's always the something that is bothering you all day long.
As I've gotten older, my dry eye has gotten worse, so I've had to work harder to manage it.
There's essentially two broad classifications of dry eyes. One is where you don't make enough tears, where the other one is where you're making tears but they're evaporating away too fast. And some patients can have both.
It's critical to find the right doctor who will take the time and has the knowledge to know exactly what type of dry eye you have, because your treatment will depend on that diagnosis.
When patients are going to have laser vision correction surgery, their dry eye condition needs to be addressed.
So if a person does have dry eye disease, they can have LASIK surgery, but the important thing that we really need to share with everybody is that we need to properly diagnose it, find out why they have dry eyes. And we have many tools today that diagnose why patients have dry eyes. And we have many tools to treat dry eyes. And so just because you have dry eyes doesn't mean you're not a candidate. It just means that we need to diagnose it, recognize it, treat it, get rid of the dry eyes, and then you're a safe candidate for laser vision correction.
It's important to manage your dry eye, if you do have dry eye, around the time of cataract surgery, because if you do have dry eye, that actually can affect our measurements that we take when we're calculating the lens implant powers.
Dry eyes can be the result of many things, from systemic diseases to blocked oil ducts, to eyelid issues, to hormones. For most, there is no cure, only treatment.
The strategies that we use before surgery is proper diagnosis and treatment, which includes a very high quality artificial tear, such as Oasis tears. Many of the patients that have dry eyes before also have a problem with the glands that supply the tear film with an oil layer. And again, we need to diagnose it, to treat it, so that it's never an issue afterwards.
I tell patients all the time, the best thing to do to take care of your dry eyes, drink more water, exercise, keep good eye health, which would mean wear sunglasses when you're outside, Blink frequently. Don't stare at the computer for hours and hours without blinking. Take omega-3s in your diet. There's great science now that shows that by taking omega-3s, supplementing that in your diet, that'll decrease your inflammatory component in your tear film and improve tear film production in general. Simple things like that will go a long way in helping your dry eyes, and it requires day-to-day management of that forever.
My eye doctor recommends a particular type of drop to me, which works so well, but it's only available from a doctor's office. It's not available in the drugstore.
I use Oasis Lid and Lash because it actually seems to take the makeup off completely. It doesn't bother my eyes afterwards, and I found that it's very effective in helping manage the blepharitis symptoms. Dry eye management isn't usually just the use of one or two things. It's a multitude of things that can make a difference in how your eyes feel.
All artificial tears are not created equally. Some are better than others. Patients who have advanced dry eyes, we encourage them to use something called preservative-free artificial tears. The reason is if you have preservatives in your artificial tear, that actually can cause a reaction on your eye that can make it red and even drier. Punctal plugs is an effective treatment for dry eyes as long as the dry eye cause is from not making enough tears. So if you're not making enough tears, you would like the tears to stay in your eye as long as possible. So we put plugs, it's called punctal plugs, either temporary or permanent. The temporary ones are dissolvable, and they'll dissolve away anywhere from 1 week to 3 months, depending on which type you use. Or you can have a permanent one, which is made of plastic, and it'll stay there until the plug falls out.
The best way I manage my dry eye is by using my drops first thing in the morning, last thing before I go to bed, throughout the day, especially when the weather conditions are windy or very dry, and I like to wear a mask to sleep.
It's just a daily regime like brushing your teeth, and that's what's kept my condition under control.
I would encourage people to go to their eye doctor for regular eye exams and make sure they ask about dry eye treatments, because the sooner you start treating your dry eye, the better your eye health will be for the rest of your life.
It is a condition that we need to treat and diagnose properly, and with proper diagnosis and proper treatment, most of our patients do achieve incredible improvement in their quality of life.
I think the most important thing when you have dry is to realize that to not give up hope, and to know that there is help out there, and there's doctors that really care, and there's doctors that know the multitude of treatments that are out there available if they just keep looking.